comment on that real quick. When we educate, we want the message to be short, simple, and culture-based. We need to motivate people. Unfortunately, the way we do that sometimes is by showing them what happens when there's no vaccine. I actually brought along a picture book, perhaps for later, that we share with folks, just to remind them of what smallpox and measles and all the rest of it can look like. With regard to media, the last bullet point there, while Twitter and Facebook are what it's about right now, it's important to build what you're messaging out based on your community. We found time and again that for us, in our major campaigns, at least for children and adolescents, a simple piece of paper sent home with the child to his or her mom is what works, not Facebook and Twitter and cell phones and everything else. The other flip side is our most expensive intervention for pediatric efforts was the radio, and that likewise worked very well. So we were at the opposite ends there. Okay, so I'm going to stop there and come back to things later on. Just to summarize, to say the time is ripe right now for adult immunization. We're on the doorstep of healthcare reform. The National Vaccine Program Office just released its adult immunization push, which, by the way, was what it did back in '94 for children. Again, right at the doorstep of the VFC. The local health department is a logical catalyst. We know our people, we're able to educate, and we're very focused on evaluation. Immunization coalitions, which I didn't mention specifically, are tremendously helpful. There's something called ACE, which we have in Baltimore City, Action for Community Enrichment, which has been a terrific source of ideas and partnership and outreach into the grassroots community. The critical nature of a data-driven effort, which is fueled by an immunization registry, is very powerful. We've reinvented the concept of missed opportunities, which in pediatrics means you don't let someone get out the door without their shot, even if they're coming there for a bad ear. You pull them in for their measles shot. We've sort of turned this around a little bit, applying it to adults. If a mom brings a child in, we query the mom about her shot. If we have an employee at work, we query them about their shots. So basically, long story short, wherever an adult pops up, we use that opportunity. We also, in the local health department, integrate services. So in-house, when we have an STD clinic, even though it's not the immunization clinic, we reach out to those patrons and immunize them with hepatitis, for example, hepatitis B vaccine. Obviously, we need dollars to do this. Free vaccines, we need support for staff and supplies. And what we've done that we found helpful is starting small, working hard, and scaling it up. So that's it. Thank you.